whole genome sequencing is really exactly that. It's a comprehensive sequencing of the entire genome. We sequence the genes, the coding part. We also sequence the non-coding parts in between genes and the introns inside the genes that don't code for proteins. And it also contains the mitochondrial DNA.
One of the questions is who to test. We can draw that from the studies. So you saw the indications for testing in most of these studies. This table here is taken from the RADI criteria.
But more and more, there are websites specifically devoted to the sorts of treatments that you would use for rare genetic conditions. An example is rx-genes.com and GTRX. These two sites provide information on a gene-by-gene basis.
So again, here we're discussing diagnoses that are made in the inpatient context where patients are in the hospital, but it's really important to remember that once they leave the hospital, there's a transition that has to take place from the inpatient providers to those on the outpatient side. And so making sure that there's a system for communication of these results from the inpatient to the outpatient environment is really critical to ensure for a smooth transition of care between these environments.
Going back to this workflow for rare disease diagnostics, when we have our patient with intellectual disability and we have our all these different types of variants that can cause this particular problem, in the dream scenario that I hope that we are already to some extent implementing in our laboratories and moving towards, is that our patient will be getting a referral for whole genome sequencing, then rapidly getting a diagnosis, and then be offered personalized care and follow-up.